My colleague, Shayna Saroshek, she's a junior faculty member at the Dana-Farber Cancer Institute Waldenström's program. She works very close with me. We have been working with her on trying to understand how we can diagnose neuropathy better. Neuropathy in Waldenström's is relatively common. About 20-25% of our patients have these presentations. And these are the patients in whom the quality of life is dramatically affected by this clinical presentation specifically. So we have a number of different tests, laboratory tests, a number of different clinical tests. And the best we can do is kind of create an association between the disease and the neuropathy. It's never a certain relation, it's just an association that we suspect, and we have either a higher suspicion or a lower suspicion. The best way to diagnose this type of situation is actually get an inch of a nerve from a patient to look at it in the microscope. But that typically renders the patient with a lot of symptoms that are going to be permanent. So we're trying to avoid that as much as possible. So we are now, what we're trying to do at Dana-Farber is we're doing these skin punch biopsies, take about 3 millimeter biopsies, nothing that patients will miss, and trying to run specific stains and immunofluorescence and even electron microscopy on these samples to see if we can create a stronger association between the IgM deposition and the neuropathic symptoms in these patients. So Dr. Saroshek is now presenting a poster at ASH looking at these findings. We have had almost 200 biopsies that we have been evaluated. We have different patterns of IgM deposition in some patients, some patterns of free light chain deposition, amyloid deposition on these patients. And I think this could potentially become a diagnostic tool for the future. It's very early still, so we are just presenting the descriptive data about this, but we're going to be looking into adapting these tests in clinical trials to actually see if there's response to patients or not. We do have a clinical trial currently looking at acalabrutinib and rituximab in patients with neuropathy. So we are going to be doing the skin biopsies on these patients so we can validate our findings in a prospective manner. But I think it's a very innovative way of looking at neuropathy and how we can learn more so we can treat our patients better.